People will ask, what is functional medicine? Or I've heard that term, but I really don't know what it means. And I think what the difference is compared to conventional medicine and what we do at Vitality. Conventional medicine is you're ill, you have a problem, it's urgent, and then, medicine steps in to try to fix that. My belief is that it's important to be proactive, come early, preventative. I want you to live a longer, healthier life. And if we start sooner than later, it's so much easier to prevent disease than reverse disease. Traditional medicine is you have an acute problem, you go see the doctor, and then they try to solve it, fix it. So it's after the fact. Where functional medicine, obviously if you have problems, we're going to deal with it, but it's kind of having a different lens. It's person-centered as opposed to disease-centered. And, I always laugh a little bit because we have the respirologist, the cardiologist, and each patients will go to different specialists and they only look within that specialty. But really, diseases don't know boundaries. And so functional medicine is trying to put all the pieces together because diseases affect everything, even depression. It's not just about the mood. It could be inflammation, gut health, detoxification, genetics. So basically, it's a very comprehensive look, and we use different tools. Sometimes it's genetics, sometimes it's functional medicine testing like comprehensive stool analysis, looking at amino acids, looking at so many different things that our regular testing doesn't really get to the root, or it's a broader way of looking at things. So when patients come in for a functional medicine assessment, one, to help save time, I will do blood tests in advance. And basically those blood tests are looking at inflammatory markers, metabolic markers, hormones, nutrient deficiencies. And then when the patient comes in, then I'm going to go through a very thorough history, finding out when their problem started. Has there been any ancillary event that may have precipitated it? I listen to family history. So I'm trying to get the big picture, what is their stress? What are they eating? It's a little bit of everything. And then what I do, because I'm really good at listening to the story, and I've been doing a lot of genetic testing, that I almost can listen to the story and pick out what genetic SNPs they have and what supplements or nutrients are going to help them. Then we'll review the blood work, and then I will replace those deficient nutrients. We'll talk about hormones, if it's appropriate or not. And it's not just sex hormones like estrogen, progesterone, or testosterone, but it's looking at thyroid and cortisol and insulin. And so it's listening and playing detective and putting all the pieces and what do I need to do to help make this person's body work more effectively so they can actually, in a sense, heal themselves with diet, lifestyle, nutrients and supplements, and potentially hormones. Why does functional medicine matter? Because again, conventional medicine's missing some of the pieces. Often people will tell me that they're doing things and they're not necessarily feeling better. So it's kind of like, it's not one thing that got them here in the first place, and it's not one thing that's going to cure them or make them feel better. So it's really using all those pillars. It's like what you eat matters, taking supplements if needed. Is it your hormones that need balancing? Is it the stress in your life? Do you exercise? So functional medicine or integrative medicine is really about doing all the things right, because unfortunately in today's world, we're living in a very toxic world, stressful world, and we need to do more. So years ago, functional medicine practitioners would just say, eat right and let food be thy medicine. But unfortunately, with all the toxicity and all these other things and COVID and neuroinflammation, we have to do way more. We have to be better at doing it. And functional medicine requires the patient to be an active participant because it's not a pill for every ill. It's doing a little bit of everything. And some patients aren't ready to do everything. So we start small. We start with what you're able to do and we shift you. And then your next thing is, well, I'm starting to feel better. What else do you have for me? And then we it's like layers of an onion. Like, you work on one thing, you work on another. And what I learned mostly in doing the type of medicine is everything is intimately related. So it's really cool and I love it.